This video presents ways to help protect yourself during IV drug use from blood-borne illnesses and abscesses. These are ways to have a cleaner shot. Wash your hands with warm running water and antibacterial soap for 20 seconds. Prepare your shot on a clean surface, such as an unread section of a newspaper or magazine, or the middle of a pad of paper. When your shot is ready, only lay it down on a clean surface, otherwise it could pick up bacteria. Clean your skin where you are going to shoot with an alcohol pad or soap and water before you shoot up. Bacteria can enter your blood if you do not clean your hands or skin area where you are injecting. Bacteria can enter your blood and infect your heart. It can contribute to painful abscesses. Do not lick the needle or the skin where you want to shoot because your mouth is dirty. Make sure you cook your drug for at least 15 seconds to kill germs and avoid infection. Same as singing the song Happy Birthday. Cooking will not evaporate your drug. Avoid muscling or skin popping. Shoot in the direction of your heart. Use a tie or shoelace to find a vein. Make sure you rotate your skin injection sites. After shooting up, do not stop bleeding with an alcohol swab. You want to use a clean cotton ball, paper towel, or tissue. Using an alcohol pad will keep your vein open, allowing bacteria and viruses to enter. Never shoot into an abscess. If your skin does swell after you inject, you need to apply ice. If the swelling does not go away in a couple of days, you need to seek medical attention. The sooner, the better. The best way to protect yourself from diseases and abscesses is to stop using. Ask about treatments at your local needle exchange. If you cannot quit, we encourage you to be smart when you shoot up. Here are some ways to be smarter. Avoid sharing and reusing syringes. If you are injecting drugs and are not ready or willing to stop, it is important to inject as safely as possible. These steps can help you avoid infection. Do not share syringes or works, including cotton, cookers, water for mixing or rinsing, or ties, as they can transmit HIV and hepatitis. If you are sharing drugs with someone else, do a dry divide on a clean surface before you add the water. Keep everything separate from your drug-using partners, including your syringe, clean workspace, and works. Do not let the other person's syringes or fingers contaminate your works. Prepare your own shot and inject yourself to avoid getting bacteria from someone else's hands. Do not reuse syringes and works, even for yourself. They can damage your veins and cause infections. Do not save or hoard cotton to reuse for later. They can transmit bacteria into your veins. Your local needle exchange program is a good source for filters. Using something like a cigarette filter or a used filter can give you cotton fever. Keep your shooting and rinsing water separate, and do not reuse water containers without cleaning them thoroughly. Mark your syringes and your works if you do save them, to prevent other people from getting HIV or hepatitis. If you are not going to be smart when you shoot up, then be prepared to get HIV, hepatitis, and other blood-borne diseases. In conclusion, the only way to prevent blood-borne diseases and abscesses is to not use IV drugs. But if you do have to use, we hope you learned from these helpful tips that were presented in this video. To seek clean needles at a one-for-one exchange, go to St. Vinny's Dining Hall, located at 35 West 3rd Street, Eureka, California. It's every Wednesday from 1 to 3 p.m., and you can receive up to 50 needles per visit. You will also receive a little brown bag with some supplies in it. The supplies include clean cotton balls, sterile water, alcohol swabs, a clean cooker, and other information about drug use and prevention. You can also go to Southern Humboldt. Visit Redwood's Rural Health Center at 101 West Coast Road, Redway, California. This is every Monday through Friday from 9 a.m. to 5 p.m. But always available is a 24-hour medical line at 707-443-1186. If you think this information could benefit someone you know, please pass it on. Thank you for taking 5 minutes to learn how to reduce your risk.